We're talking with Dr. Benjamin Domb, an orthopedic surgeon practicing in Des Plaines, Illinois area. He specializes in sports medicine, and we're talking about hip arthroscopy.
This is a surgery that we do for pain. That is our profession, is to treat people's pain and dysfunction. We really thought of hip injuries as something that happened to your grandmother when she got arthritis and used a walker and then maybe had a hip replacement. So we didn't think about hips as subject to athletic injuries. And of course, now we know very well that they are. And one of the things that probably led grandma to being on a walker was she probably had a labral tear at some point along the way, and that led to the deterioration of the mechanics of the hip joint. So we've come to understand that the labrum is critical to seal the ball in the socket and seal the lubricant fluid in the joint, thereby creating hydraulic dispersion of the forces evenly across the cartilage surfaces. And when that fails, when the labral seal fails, then we have eccentric loading of the cartilage, which, just like in any other joint, leads to fairly accelerated degeneration. In any given day, I might see somebody who's 12 years old and a dancer with a labral tear, a 25-year-old professional football player, a 45-year-old recreational CrossFitter, and a 65-year-old golfer. Their hips may deteriorate through a common pathway of a torn labrum. And when we have the ability to address that, if we can detect it early enough that we can administer preventative treatment with an arthroscopic repair, then in at least some cases we may slow down or even halt the process of arthritis. And in some of those patients, we may prevent or at least delay the need for a hip replacement.
A founder of the American Hip Institute. Maybe tell us a little bit about that.
Sure. So the American Hip Institute Research Foundation is a nonprofit foundation, 501c3, dedicated to research and education. The goal of the American Hip Institute Research Foundation is nothing short of curing arthritis and joint pain. My personal vision is that if we have a chance at curing arthritis and joint pain, or at least some significant portion of it, it's probably not going to come in the form of one magic pill. It will more likely be three pillars, the first being early diagnosis, the second preventative treatment, and the third curative surgery. Preventative treatment, it comes a little bit later, which is where we have an injury like a labral tear or impingement, but we're catching it early enough that we can repair it, we can address impingement, reshape a femoral head that's out of round to make it round so it doesn't rub anymore. And those things at this point have been shown to extend the life of the hip and delay or in some cases prevent the process of arthritis. And then the third, curative surgery, that's the third pillar. That's when we've failed to do the first two. We haven't diagnosed it earlier, we haven't administered preventative treatment, and it's become arthritic. And, in that case, a hip replacement is a fantastic answer. The Lancet called it the best operation ever invented in the history of medicine. So I think between those things, if there are 50 million Americans right now suffering from arthritis and joint pain, if we take that example in the hip and we extend it to the shoulder and the knee, then we can make a dent in arthritis and joint pain. And that's been the goal of the American Hip Institute Research Foundation throughout, and we've sought to achieve that goal through research, through primarily clinical outcomes research, through education in the form of our fellowship, which is one of the first, if not the first, comprehensive hip fellowships in the country, and through education of surgeons far and wide at conferences and courses and the like.